Okay, it's all yours.
Thank you. And good morning, everyone. And I'm so happy to join you today. I was hearing your announcements. There's a lot of activities, a lot of things going on. So it's great that this group stays active and stays engaged in the community. So I'll talk a little bit about myself, but as I do that, I would like for I want to engage you guys a little bit. So I am Dr. Deidra Parrish. I am the health director for Arlington Public Health. So when you think about public health, what comes to your mind? So if you could put in the chat a one word that comes to your mind when you think about public health. Um, I always find this interesting. So go ahead and put that in the chat so I can kind of see what people's thoughts are and what your concept of public health is. So, in terms of my background, I am a preventive medicine and public health physician with a subspecialty in infectious diseases. So, so with that, I'm really primarily focused and have focused much of my career on infectious diseases of public health significance. So what are those? Those are things that cause pandemics like, HIV, like, obviously COVID and some of the other types of uh, epidemic viruses, but also things like tuberculosis, malaria, all of these things I've worked in over my career. Um, Prior to me joining Arlington Public Health, which I joined in September, I was at the United States Agency for International Development, where I worked with the President's Emergency Plan for AIDS Relief. So in that role, I had a portfolio of, different countries that I advised on their HIV programs, particularly related to treatment. Um, and prior to that, I worked domestically in public health in Tennessee for about a decade, both state and local. And if anybody's familiar with Nashville, that's where I lived and worked for the Metro Nashville Health Department as well as for the state during that time. And prior to that, had other roles in at universities and doing more so kind of public health research, as well as did a couple of years stint at the Centers for Disease Control and Prevention in Atlanta, focused at that time on sexually transmitted infections. So so that's a bit of my background. Um, so I'm seeing in the chat uh, infectious disease like measles, yeah, prevention, COVID response, prevention, response and planning for major health items for overall community population. I love it. Yeah. So you got it. You know what I'm talking about. So I'll have a short slide presentation and then we could spend probably the majority of the time with some questions and answers. So I'll start sharing my screen now, but really glad that you guys are really public health focused here. All right. So I'll talk a little bit today about who we are and what we do in Arlington Public Health. Um, I talked a bit about my background, but I usually start these presentations with a story. So the story is, a group of physicians was having lunch in a park by a river. All of a sudden, they saw someone struggling in the water. So one of the physicians runs into the river, pulls out the person to safety. Moments later, they see a second person in the water in distress. Another physician runs in, pulls that person out. And then moments after that, they see two more people, coming downriver in distress. So at that point, one of the physicians stands up, looks north of the riverbank and starts running north. The other physicians are like, "Where are you going? We have to save these people who are in the river." And then the physician who was running up the riverbank said, "I'm going upstream to try to find out who is throwing these people in the river in the first place." So that story is emblematic of public health. Public health is not primary care. It is looking upstream, looking at the factors that contribute to, health in populations. So, what is public health? As mentioned, it is population based, not individual based. And my patient, uh, is Arlington. It is the entire community. And we really focus on more structural, factors that affect the health of populations. Within public health, we partner with many, many groups. And as you can see in this kind of matrix, and this is not exhaustive, we do partner with healthcare entities such as hospitals, laboratories, physician groups, private practice, our safety net healthcare providers. We also partner with corrections and parks and home health and mass transit and a lot of entities related to the built environment as well as human services. And always we, again, focus upstream. And what that entails often is looking at policy in many instances. So part of focusing upstream is looking at the social determinants of health. And you may have heard of social determinants of health, or sometimes called structural determinants of health. And these are the conditions in the environments where people are born, live, learn, work, play, worship, and age. And social determinants of health are important because when many people think of health, they think of factors related to the individual and their choices. But social determinants really, changes the frame and shows a fuller picture of how the environments affect, people's lives and health. So if you think about education, which is one of the components of the social determinants, you think about school, school funding and what resources do the schools have, to help students to thrive. Does the school have, a post-secondary education counselor to help students to get into higher education or post-secondary opportunities? You think of the environment, is there green space? How is there air pollution, noise pollution? All of these things, can affect health. When we think about specific neighborhoods, you could think about, is it near industrial sites? Is it near toxic sites? Is the neighborhood walkable? Is the neighborhood safe for people to do their activities? When we think about social connections are a strong mitigating factor for some of the negative effects of some of these other social determinants. Meaning, if you have strong bonds in terms of strong connections to other people, such as with different groups, different organizations, different even family or religious institutions, then that is a mitigating factor for negative health effects. And then you think about the economy. Is there job availability? Is there job security? Obviously, even more recently, we're feeling the impacts of some economic changes with layoffs, et cetera. Obviously, all of these impact health. And then when you think of housing, one of the first things you think about is do people have housing? Because we know that unhoused people are at very high risk of poor health, for the simple reason of not having that place to live so that they can focus on and maintain their health. But even if you are housed, what is the quality of the housing? Is it, how's the upkeep? Is there lead paint? All of those things. And then you think about healthcare, and some people think about this first, but I went through this to highlight that it's not just about healthcare, but even in terms of healthcare, is there access to healthcare? Meaning, do you have a primary care provider? Can you get into a primary care practice? What about the quality and the acceptability? And acceptability is very important, particularly for communities that have been marginalized. So Arlington Public Health, in terms of who we are a division within the Department of Human Services. So you all, I know that you all are very familiar with Aging and Disability Services, led by Maimuna Ba. I know she's a frequent partner to you, and so that agency is a sister division within the Department of Human Services. So we all are co-located there at Sequoia Plaza, and we share the same vision of a just and equitable community that is healthy, safe, economically secure, and free of systemic racism. And you see our mission and values here. And I would encourage everybody to visit the county's website and look at realizing Arlington's commitment to equity, which again, the equity component really influences health equity as well, which is what we are about. So the three pillars of public health are prevention, health protection, and health promotion. So these are a few kind of categories of some of the things that we do within each of these pillars. This is not exhaustive, but many of you brought up prevention when I said what comes to mind when you think of public health, and that's one of the top things, and that's again one of the reasons I went into this field. So immunizations are really one of the backbones of public health, and all about preventing disease. And we do a lot of immunizations for a lot of different diseases within our division. Prevention also is inclusive of family planning, sexually transmitted infections, which we both treat and prevent, as well as tuberculosis. In terms of health protection, this is public health's role in protecting the public. So one important activity that we do is restaurant inspections to ensure food safety. And so these are done on a regular routine basis just to ensure that that people eating at restaurants will not get sick from the food. Many people now are very well aware of public health's role in outbreak response and emergency preparedness, of course, with the recent COVID pandemic. And also there are a number of reportable diseases that public health investigates, and I'll talk about some of those later. Health promotion is the third pillar, and health promotion, we do a lot with schools, with our school health nurses that are in the schools, and also with partnerships with the communities. WIC is a Women, Infants, and Children Supplemental Nutrition Program that that helps to ensure optimal nutrition for pregnant and breastfeeding women and infants. As you know, here on this slide, several of these activities have an asterisk, and these are the activities that are mandated by the Virginia Code. So these are things that public health must do. And for some of these, we are the only entity that does these, such as restaurant inspections, obviously, and outbreak response. So before I leave this slide, I want to note that even though I kind of categorize, these different activities under these different pillars, there are some activities that span multiple, pillars of prevention, protection, and promotion. So for example, tuberculosis. Treating latent tuberculosis infection prevents active tuberculosis disease. And treating active tuberculosis disease protects the public, from a very contagious, disease that's spread through the air. So TB can really be under both prevention and health protection. Likewise, school health fits under all three pillars, because within the schools, we give immunizations. Within the schools, the public health nurses in schools help with contact tracing if there's an outbreak or a reportable disease in a school child. And of course, school health does plenty of health promotion activities, including health fairs. So on this slide, I have the list of the reportable diseases in Virginia. And I know the writing is small on this slide, and I'll provide like a PDF, after this meeting. It's not intended for you to really read everything, but just to, see the scope and amount of diseases that public health is responsible for monitoring and investigating if we get a case. Some of these, like these on the left, are some of those really significant diseases that need to be immediately reported. These are the ones that, are typically can lead to outbreaks, things such as measles, such as viral hemorrhagic fevers like Ebola, yellow fever, agents that can be used for bioterrorism like anthrax, et cetera. So there's some of these that are kind of really high priority. And then on the right column, there's plenty more, also important, even if not kind of more associated with outbreaks. But on this list, it includes a lot of vector-borne diseases. So when we think about vectors, we think of those, creatures that transmit disease. Like if a disease isn't transmitted person to person, it goes through a vector. And so some of our common vectors are ticks, which transmit, many things, including babesiosis, Rocky Mountain spotted fever, Lyme disease. Also, it can lead to alpha-gal syndrome. This is the newest disease on the reportable disease list. And alpha-gal syndrome is interesting because it is a disease that causes allergy to red meat after a tick bite. So you get a tick bite, and then several weeks later, you develop an allergy to red meat. So it is quite interesting and relatively novel, but we've been seeing it for quite a few years. But it was just recently added to the reportable disease list. So another important vector, and probably the most important vector of reportable diseases is the mosquito. And so globally, we think of malaria, which is the most significant vector-borne disease that is the most deadly. But even within the Americas, we have plenty of mosquito-borne diseases. I know probably several years ago, you heard of like chikungunya and Zika and even dengue, which are still, circulating in different parts of the Americas. And in the US, we have West Nile virus, St. Louis encephalitis, Eastern equine encephalitis, all transmitted by mosquitoes. So there's several of those. So so this is a snapshot of what we do in public health. So I'm going to stop there and I'll stop sharing my slides and I'll look forward to questions.
Well, the first question is the county budget is very tight this year. Is your agency being affected by that?
So I think every agency is being affected by the tight budget. Um, you you may have gone to the or seen the budget presentation and seen um, what was uh, presented. And what was presented is that we would that public health specifically would lose one position. Thankfully, that position was vacant. So if everything goes according to the county manager's proposal, then we would lose one position. So that's the good thing. Like I said, it was a vacant position, and additionally, we may get one new position of a public health nurse for the new high school. So overall, it's a bit of a wash, even though the position that we're losing was different from the position that we might gain. But we all understand the economic realities right now, and again, I think every department is affected.
Next question is, are there any transmissible diseases with a vector of birds, rodents, or other types of critters?
Well, typically the only well, I mean, there's in terms of you know diseases that are kind of with public health significance. Rabies is the one that is transmitted by rabid animals, and usually raccoons, foxes, bats. So that's one that is the most significant there. Otherwise, there are some reportable diseases and infectious diseases that are maybe transmitted by like fleas of certain animals, such as plague. Plague is one, and it's actually transmitted by the rat flea. It's not the rat itself, but the rat is or is a signal that there may be fleas and could transmit something like plague. By the way, plague is not something that is common in this area. So mainly, yeah, primarily rabies is what we think about, but most vectors are insect vectors.
How are you adapting to some of the new direction coming from Health and Human Services, especially as they relate to vaccines and the food pyramid?
Great question. And actually, you might have seen very recently that the Virginia Department of Health, which which Arlington Public Health is aligned with as one of the health districts of Virginia, the Virginia Department of Health has adopted the childhood immunization schedule of the American Academy of Pediatrics. So, so with this question, the background of it is, with the current administration and the current HHS leadership, there were changes to vaccination schedules. Or first, there were changes to the group that actually advises the CDC on vaccinations, and then changes to the vaccination schedule directly. And these changes were not based on any new science or evidence. So a lot of the medical societies, the Infectious Diseases Society of America, the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, the Family Practice, American Academy of Family Medicine, all of the medical societies really, focused on maintaining an evidence-based immunization guidance. And a lot of states and public health jurisdictions have aligned with those medical societies, which are all aligned in maintaining the immunization schedule as it was before the change, because there was not scientific evidence for justify that change. And so there was an announcement, I think it might have been a couple of weeks ago, that Virginia Department of Health is aligning with those, with the AAP recommendations, and so are we. In terms of the food pyramid, again, that's when we give advice about control or prevention of chronic illnesses, whether it be heart disease, diabetes, et cetera, there's clear evidence related to how folks should eat and what types of diets have shown benefit. And so we follow the science.
Okay, next question is tuberculosis is mentioned frequently. Where are people coming in contact with TB? Are there any hot spots around the country or elsewhere in the world?
So TB is, TB has always been here, right? TB is one of those diseases, that have, the earliest records that can be interpreted from ancient civilizations. Whenever a disease is described, TB is always there. So TB is around. The good thing is that TB rates have decreased in the U.S. over time, and they're continuing to slowly decrease, which is great. There's in terms of hotspots, there's not like any big kind of clustering of sites or places where there is TB. The thing about TB is that someone might have been exposed to it early in their life and have what's called latent TB infection, which is that the TB bacterium is basically sleeping in their body and then it reactivates. So that could be years, decades later that it reactivates. And when it reactivates, it can cause active disease, which with all the symptoms related to it. So when we look at TB, we try to actually test people for latent TB infection. And some of you might have, depending on what type of job you might have or have had, some of you may have gotten a TB test to see if you have latent TB infection, because if you do have that, there's treatment that can kill all the bacteria that is sleeping or hiding in your body before it reactivates to cause active disease. But when we do get an active case, we do treat them as well. A lot of again, you know, folks with TB, they may have picked it up, anytime in their lifetime, and sometimes it's hard to say where or who. Sometimes they know of somebody, maybe in their family, a neighbor, or somebody they work with might have had TB. Sometimes they don't know. And then if you travel at all, there's more TB in some countries than others. So people that have spent a significant amount of time in countries that may have higher rates of TB may be exposed and have latent TB that can progress to active TB. But overall, it's declining in the U.S., but we still have it, and the important thing about TB now is there's a lot of drug resistance. So many of you are already aware of, drug resistant bacteria. Obviously, there's a lot of them, a lot of them that cause hospital associated infections. But TB is also one of those bacteria that have developed resistance to a lot of the medications. So that's still a risk. And again, why we want to focus on, preventing that active TB by treating people with latent TB infection.
All right, next one is this person's doctor recently got after her for the MMR vaccine, and he said they're finding that a lot of people never got the full series as children and aren't protected. Is that something you guys are publicizing? Is that something we all need to talk to our doctors about?
I think it's helpful to talk with your doctor about your measles immunization status. So I think over the years there have been different recommendations related to measles vaccinations. Currently, it is recommended to get at least 2 doses, one of them at approximately 12 to 15 months of age, and then a booster dose or a second dose at entry to school. Um, if you're an older person, um, you might have only gotten one because maybe the second dose hadn't been recommended at that time. And if you're a much older person, you might have even had measles yourself, and then you have the immunity from the infection. So an easy way to find out is just to get serology, um, basically asking your doctor to test you if you're immune to measles. Basically, it just tests your antibody. If you have antibody to measles, then you're protected. What we're finding in terms of, I'm sure all of you are aware of the different measles outbreaks in the US and different measles cases. What we're finding in those cases is that most of the people affected are people who have not been vaccinated, and there may be a couple of cases where they might have had one vaccination, but it might have been so recent that it might not have taken effect before they were exposed. So the primary risk is not being vaccinated at all. But if there is concern, definitely you can get your what's called serology or titers done to show if you are immune based on your antibody.
Do you have any statistics on what fraction of Arlington's population is or isn't vaccinated against measles?
I have the data um, for I have the data for childhood vaccination for measles, the most recent. In fact, we presented it this morning earlier to a VDH forum. So in the schools, we have school health. Because of all of the measles cases that have been reported throughout the country and some in the state. We actually looked at our Arlington school children to see, what percentage have the full vaccination, and it was so basically over 99%, like so 99.5 95% have had at least one vaccination, and like 98.9% have both MMR vaccinations to be fully immunized. And that is very high. That is optimal. And, Arlington has, probably the highest rates of measles and MMR vaccination in the state, and probably some of the highest in the country. So yes, we are. Um, we should be proud of ourselves, and Arlington has been very focused on prevention and ensuring that the vaccination rate is high, and we need to be vigilant in maintaining that high rate of vaccination.
How big is your staff? How many people work in your department?
So Arlington Public Health has about 180 total staff members. And so this includes everything from public health nurses to epidemiologists to our inspectors. We have, our clinic staff, including some nurse practitioners and a medical services physician, our front desk staff at the clinic. We have outreach staff. So total, and of course, all of the back end stuff, the finance and admin. So total, we have about 180 or so staff members.
Okay. Are there certain public health services that you offer that are specifically targeted to older adults?
Yeah, that's a good question. Um, I'm trying to think offhand. There are sometimes some different outreach events that we participate in, and often we, public health partners with Aging and Disability, our sister division, to do some of those outreaches. But we don't have a specific service that's targeted to older adults. Of course, all of our services are open to everyone. But if there is a significant kind of public health need, among older adults, we're definitely happy to explore. And again, working with our aging and disability division as well.
Do the Arlington schools require proof of vaccinations for all school children? And what kind of vaccinations do kids need to have?
So there's a vaccine schedule, and the Arlington Public Schools website actually has all of that information and has the information about what vaccines are required for school entry. And typically, there are those vaccinations that are recommended now by the AAP, the American Academy of Pediatrics, which includes things like MMR, diphtheria, pertussis, and probably a couple of others. I'm not listing them all off the top of my head, but there's a whole kind of vaccine schedule, and there are requirements for APS.
What's your biggest concern as it relates to health in Arlington, and how are you addressing it?
So I think my biggest concern about health in Arlington is health equity. And so health equity means ensuring that everyone has the opportunity for optimal health. And to do that, you really need to focus on those areas and populations that have had poor health outcomes. So many of you may remember my predecessor, led led an initiative called Destination 2027, which actually looked at population health in Arlington by census tract. So, in looking at that and looking at metrics um, like lifespan, it was identified that even though Arlington is a healthy county, one of the healthiest counties in the state and in the country, there are still pockets of disadvantage within Arlington, with a disparity in life expectancy of 10 years from the healthiest part of the county to the least healthy part of the county. So, how do we narrow that gap? How do we ensure that those communities that have the poorest health outcomes really get what they need to have better outcomes? And so that's something that we'll be working on. We'll be looking more closely. We plan to do a community health assessment, again, focused primarily on those geographic areas that have some of the most disparate health outcomes to identify priorities and to work with those communities to jointly develop a community health improvement plan. And then we'll work the plan and hopefully, improve some health outcomes.
Does your agency work with the Arlington Free Clinic? The comment they think the clinic is for people with no insurance.
Yeah, as I mentioned in the slideshow, we partner with our safety net providers. So our safety net healthcare providers in Arlington are the Arlington Free Clinic and Neighborhood Health. So yes, we do partner with them. Obviously, we don't provide primary care, but Arlington Free Clinic does, and Neighborhood Health does. We primarily we work together in terms of identifying needs and kind of monitoring kind of the health of the community. And sometimes we do different activities together, like for instance, Arlington Free Clinic, along with the Community Foundation, hosted a social determinants of health workshop for some board members of different community organizations that we participated in that. So yes, we're in very close contact with Arlington Free Clinic.
In the future, will older adults need to continue getting COVID vaccinations on a regular basis? And if so, are local pharmacies going to make those shots available?
Yeah, so it really depends on kind of how COVID evolves in terms of the rates of COVID. So as we saw, it came with a bang, as this global pandemic, and then it has kind of receded to be kind of an endemic, which is what we call almost like everyday virus that kind of has its ebbs and flows. Will it continue to be that? It's probably not going away because there are very few viruses that emerge and go away. In fact, I can't even think of one. So similar to some other seasonal viruses like flu or RSV, COVID-19 is probably here with us, for the long haul. And again, similar to flu, is probably something that all of us will need to get vaccinated for annually. Again, depending on how it evolves. In terms of availability, I can't speak to availability, but hopefully, if there's a need, then the pharmacies will there'll be access to it. So that COVID is another one of those reportable diseases that is closely monitored, and as a preventive medicine physician, I highly recommend vaccines, period. All vaccines that have been approved have undergone rigorous testing. And for me, the way I tell my patients when I've had individual patients is, you'd rather be protected than not protected. And, and even if some vaccines like the flu shots, if they're not, you know, 100% effective, if they're not completely aligned with the flu that's circulating that year, some protection is better than no protection. So I anticipate that, COVID again will just be one of these kind of seasonal, viruses, and we'll need to continue to protect ourselves from it.
Have you seen any health effects of that massive sewage spill that occurred in Maryland and dumped all that sewage into the Potomac River?
No, we haven't seen any effects. And I think part of the reason is that it was during like a freezing time. So nobody's in the water, which is great. And I know that um, everyone should just keep an eye on the advisories. So Virginia Department of Health had issued an advisory not to have recreational activities in the Potomac. More recently, at the beginning of this week, they partially lifted that advisory for a particular section of the river. So I would say just keep an eye on that if you want to have any activities in the Potomac River. The good thing is that the spill has been contained. There's still cleanup to be done, but um, but as we go, as we have time and more water flow, then some of the risk is decreasing as things are being diluted. There is still ongoing testing on the river, primarily through Maryland and DC. Maryland has jurisdiction over the Potomac River, so they are the primary player, and of course DC is also monitoring, and VDH also, Virginia Department of Health, and also the Virginia another Virginia department that focuses on the environment. I forgot their acronym. They also have some monitoring at different sites along the river. So I think Virginia Department of Health actually has a website specifically on the Potomac River spill that has all that information. And as soon as they have enough data, they will evaluate their advisory and lift that advisory at the point where everything, all the measurements are back to baseline.
Yeah, I've got a comment here that W&L has a rowing team that rows on the river. I saw that online that they just gotten back into the water. So, are there any emerging threats that you guys are monitoring for that we may not be aware of, either diseases or, toxins or pollutants or anything like that?
So not right now, thankfully. There's always scanning, there's always monitoring actually worldwide, because if you recall about COVID, there was just these few, instances of this respiratory illness in China. And yeah, I remember like the weeks and couple of months leading up to, when everything kind of broke loose, hearing about that and hearing, some episodes in some other countries and whatnot. So that's something that public health monitors, um, you know, with um, with networks and partners, worldwide. Um, there's not really much on the radar. Of course, that can change at any time, and that's what keeps us on our toes and makes it exciting and fun for me. Um, the main thing um, that I think we want to focus on, especially in the U.S. right now, um, is vaccine confidence. as we're seeing all these measles outbreaks, the underlying reason for this is that people aren't getting vaccinated. And why are people not getting vaccinated? There's misinformation, there's disinformation about vaccines in general and about particular vaccines in particular. So that really needs to change. And, there are a lot of, reputable groups and organizations and agencies that are working to to really address vaccine hesitancy. It doesn't help when there's mixed messages, especially from officials. So, you know, as I said, I'm a proponent of vaccines. Vaccines work. Vaccines are why many of us are alive. And, for those who've never seen a person with polio or with the crippling effects of polio, if you saw what vaccines, what those diseases did before vaccines were available, or accessible, then, you would think twice about, refusing it for a vague reason. So I think that vaccine confidence is one of the key things that we need to reestablish in this country.
Do you get any funding from the federal government, either for ongoing activities or in response to things like the COVID pandemic?
Yeah, so a portion of our funding is federal, and mostly is the funding kind of passes through Virginia Department of Health and comes to us. There's certain of those programs that I had on that slide are federal programs like WIC, Women, Infants, and Children Supplemental Nutrition Program is a federal program that is administered and implemented through the health departments. Obviously, during COVID, there was a lot of federal funding. We don't have that federal funding anymore. That stopped. We do have federal funding for our emergency preparedness. Many of those are federal grants that come through the health departments. So yes, a portion of our funding is federal.
Because we are such an international area, does that present any unique public health challenges?
Yes, it does. So anything unusual, that's happening anywhere in the world, we could see it, and we could see it earlier than many places because, we have, you know, Dulles Airport and Reagan National Airport, obviously Reagan National Airport within our jurisdiction, but Dulles Airport nearby. And, we're, right across the river from the nation's capital. So that poses, you know, so that makes us particularly susceptible to, um, to anything that may be happening worldwide. So yes, and that's again something we monitor, especially with our emergency preparedness, and and there are kind of coalitions of different health departments and public health groups within the metropolitan Washington area, so that we all can kind of be up to speed on what's happening, between Northern Virginia, DC, and Maryland.
Would it be helpful to remind people that measles can have very bad effects on a developing fetus? So do you have public health messages, that kind of thing?
So there is messaging, and particularly related to measles, and most of this messaging is coming through Virginia Department of Health, and we tend to amplify it. So there is, there's focus on, the how serious measles is. I mean, sometimes people think, oh, measles was a childhood illness. People got a rash and got over it. Some people did, but some people got encephalitis, so infection around the brain. Some people, got pneumonia and died, or and of course, the risk for pregnant women, particularly. So there are a lot of risks for measles as well as other vaccine preventable diseases. And obviously one of the reasons that vaccines were developed for these diseases specifically was because of high, you know, the high risk of complications and death from these diseases. So those messages, are being shared. Yes.
Do you know what kind of air quality manage or monitoring is done inside the DC metro system?
I do not. I do not.
Okay.
And I
I,
see that we're a little over time, so I can, yeah, probably take one more question before I have to hop off.
all right. Well, I don't see any remaining questions. If anybody's got one last one. Nope. I think you've answered everybody's questions.
Well, that's great. This is great. I love to, as you can see, I love to talk about public health in general. So I appreciate all of your interest and enthusiasm and great questions. And I just want to encourage you all to, to be, our public health advocates, in the field, um, and continue to do the great work that you're doing as well. And again, I appreciate you having me on today, and it was great meeting you all.
All right.
Thank you.